Hey guys, we are back with some more health knowledge for you. Today we're going to talk about the thyroid. On Thursday we're going to be back with Dr. Tiffany Love, kind of telling you how Hawk Fitness and her office are teaming up together to help you take charge of your health a little bit better and on a little deeper level with some blood work and some joint consultations and things like that. But today I want to talk about the thyroid because the thyroid is a really big issue and lots of people are struggling with their thyroid health or they're already on medication for it, and they don't really understand what's going on. And I cannot tell you more that your health is not your doctor's responsibility. That's your responsibility, and your doctor is there to facilitate you. So if you're struggling with something, it's really up to you to go out and learn more about what's going on in there. So your first step here is to know what's going on with your thyroid. So your thyroid is a little butterfly-shaped gland that's located in your throat. The thyroid produces T1, T2, T3, T4, and calcitronin. Okay, really the most important thing here is T3. The thyroid outputs, like almost 80% of what it outputs is T4, and T4 is converted by your body into the very highly usable form, which is T3. Any T3 that's not used, or any T4 that's not converted to T3 because you have enough is converted to reverse T3. But reverse T3 is not actually produced by the thyroid. Okay? Your pituitary is located in your brain, and it produces what's called TSH, or thyroid stimulating hormone. Most doctors are testing for TSH. So that's good and that's bad. The TSH is important because when your body's not getting enough of this T3, it is sending a signal through a feedback loop to the pituitary saying, hey, produce some of that stimulating stuff because our thyroid needs to work harder and make more because we're not getting what we need. So when a doctor's testing for TSH, that's letting you know if enough TSH is being produced or too much TSH is being produced, but that's not really a reflection of thyroid health. It is a clue to thyroid health, but it's not a reflection of thyroid health. So this could be a perfectly normal number. You could still be having typical thyroid, hypothyroid symptoms like a low body temperature, you're cold all the time, hands and feet are cold, you're sluggish, you're gaining weight for no reason, depression, or a low mood. All of those are symptoms that the thyroid's not functioning properly, but your TSH number might be normal. And so the TSH is telling you only if the pituitary is producing it. It's not telling you then if the thyroid is taking that message, turning around. Is it even producing enough T3 and T4? Maybe it is. Is it converting T4, or are you converting T4 into the T3 that you need to be usable for the body? And is that reverse T3 being produced as well to clear the body? All right. The other thing that often isn't getting tested for is antibodies against the thyroid to see if your own body is attacking your thyroid. So there's different types of hypothyroidism. There's regular hypothyroidism, and then there's Hashimoto's hypothyroidism, which is where your own body is attacking your thyroid for some reason. And the protocol for dealing with that looks different. So this gives you just a really quick overview of where you might be coming up short in the blood testing. And we're going to talk with Dr. Love a little bit more on Thursday for you to learn more about what this all means and how can you test for it. And then once you test for it and these numbers, what do you do with that information? And that's where we come in with Dr. Love and help you with that through nutrition and supplementation and things like that. There's so much you can do for thyroid health, particularly if it's not autoimmune, to not have to go on synthetic thyroid medication. All right, so stay tuned. Check back with us on Thursday, and we'll have lots more info for you. We are back again with Dr. Tiffany Love. She was in the middle of her workout, and I said, come on, let's go make that video. So she's a little worried because she's in her workout clothes, but she looks great. And we're going to finish talking to you a little bit about thyroid and tell you about some of the exciting things that we're teaming up to do to help you have the best health of your life. So, Dr. Tiffany, tell us a little bit about why this thyroid health stuff is so important.
Okay, first of all, I want to just say thank you to Becca and to Haka for inviting me to come and do this. I'm very excited to help educate you guys about, health and prevention. We're focusing now on the thyroid as it's a major component in regulating how every cell in your body is maintained ultimately. So,
Not to interrupt you, but I was reading a thing about Thyroid Health the other day that was talking about how when your thyroid is not, like you can't live without the thyroid, without the T3 that we talked about. And so when that's not optimized, you're slowly dying.
correct.
So that's why you feel so crappy when your thyroid's not working. You are slowly dying.
So the thyroid is, this little butterfly gland, as Becca told you about on Tuesday, and the importance of it is just extraordinary because it is ultimately responsible for your growth and metabolism regulation. And as far as, terminology, I'm not going to go into too much depth, but keeping your thyroid in check is very important, and it's something that I think a lot of us as, just in general, we kind of are like, I'm feeling a little tired and sluggish today, and yeah, I just didn't get enough sleep last night, and oh, my kids are sick, and I'm just really worn out. I mean, work is stressing me out, and it's just a lifestyle that we lead, and we kind of just go down that road, and we forget about, like, us and what we need to do, and is that really how life should be led, and is that really how we should feel every day? And no, it's not, and these are all signs and symptoms of a potential thyroid condition. And it's not necessarily, maybe you're hypothyroid, or, you've got hypothyroidism, and that, it's this, grave disease that you're gonna, go down that road.
You can slide in and out of that based on your lifestyle at times. Like for me right now, postpartum is a real time when thyroid health can really decline.
Absolutely.
And so really
your
protecting
stress levels go up, your time just for yourself goes down, your nutrition probably goes down because, you're really trying to balance life. And this is what's so important about this little structure right here, is that every single, tissue and organ and cell is basically regulated and controlled by this right here.
So how do we test? So we're teaming up and we're doing a lot of consulting with people, and they're coming to you and you're writing a script, essentially, getting some medical history. You put a script out for the blood work for that, and then what is that blood work? Like, what all are they testing for? Because out there, unfortunately, in the medical profession, it's hard to get all the testing you need. You have to beg and plead for it, and
and I think the problem is more so.
It's probably insurance.
I don't think the testing is really different. I think it's just the fact of going in depth and figuring it out. Like, I think a lot of times people just get this report and they're like, oh, my TSH levels are, they're fine. So that means my thyroid's good. I'm good. Like, there's nothing wrong with me.
But if you feel that, the number one indicator is symptoms more than
symptoms,
TSH.
Absolutely. Yeah. So just to, kind of go briefly into some symptoms, let's just talk about that really quick. As far as, mental health, if you're having anxiety a lot or nervousness, if you're having depression or you just can't seem to, get out of this funk, immunity issues, if you're having, colds and flus and you're not able to, beat it, absolutely, or
cold body temperature.
Even cardiovascular issues, if you're having issues with your blood pressure or your cholesterol, if you're having constant pain, inflammation, migraine headaches. I can go on and on and on. The list is just impressive, really. Mood changes, shortness of breath, or
I was reading about
heart palpitations.
Your ears itch all the time is actually one of it, or
little hair, nails, dry
scratchy
skin.
patch on your index finger. Eyebrows start to shorten. But I think other big ones are like cold hands and feet all the time, and then just like unexplained weight gain is another big one.
Yes.
And that's, I think, a lot has to do with the adrenal side of so like the stress part.
So this circle here, so basically Becca went over, T3, T4. These are the main thyroid hormones that basically help regulate those chain of reactions of other hormone cascades that trigger other scenarios into the body. So the kidneys, or the adrenal glands, basically also produce a hormone that I'm sure you all are well aware of, Becca, cortisol. Okay, cortisol is your stress hormone, and cortisol plays a huge role in the function of your
that's your kidney, yes, and that's your adrenal.
Cortisol plays a huge role in your thyroid function. So if your stress levels are extremely high, it's going to kind of signal, a negative feedback loop to the pituitary gland, which is then going to signal to the thyroid to, stop producing or lower your TSH levels, therefore affecting your T3 and T4 levels. So ultimately, it's not just your thyroid that you have to be concerned about. It's your, it's your pituitary gland. It's your, hypothalamus ultimately, which releases a hormone that stimulates the pituitary to stimulate the thyroid to stimulate,
yes,
all these things.
TSH really simplifies it much.
Yeah.
So, way beyond what it really is.
So I don't think TSH, which is called thyroid stimulating hormone, by the way, I don't think that's the only hormone that you really need to be focusing on. I think it's extremely important that you also, talk with your doctor or, somebody who can really go over the importance of what you need to have tested, the importance of why you're testing it, and the solution for it. And that's what we're, I'm doing.
I was going to say, you're being too humble. So basically, that's what we're doing.
Becca and I are teaming up, and we're going to really get to the bottom of this, because it's it's really kind of becoming an epidemic, and people are just, I think just going through life thinking that it's just normal, and it's not. So,
well, I think they think something's wrong with them. It's getting blamed a lot on menopause, and that bracket too, where this thyroid issue really shows up, is kind of that middle-aged woman, a lot, and there's a lot that plays into that. We have a great video on the HACA website about stress, and you could tune into that one, and it's pretty long. It's a whole talk on stress, but that's a big part of it. But unfortunately, I think these women, they get diagnosed depression meds and anxiety meds when really the real problem is coming from this thyroid health, which probably for the majority of people is coming from gut issues and these adrenal fatigue and things like that. So basically, let's just give them an idea. So the panel, the blood panel that we're writing up for you, it tests literally all the components.
Yeah, so there's different, obviously we need to sit down and chat about your health history, your medical history, your family, social, all of that, and figure out, what's going on. From there, basically, I go into your symptoms and, your clinical relevance as far as, okay, maybe this is. And from there, I put together some differential diagnoses so that we can set up the appropriate blood work. So typically, a thyroid panel will include your TSH and your T3 and T4 levels. However, it is, I think, extremely important that we also, and Becca touched on this on Tuesday, test the reverse T3.
The clearing out of the system.
And that is a super important thing that we need to look into, along with any antibodies that might be present. There's anti-TBO, there's anti-TG, there's all different antibodies that potentially could be present in your thyroid, and that being said, is a very strong indicator of some potential autoimmune issues that could be popping up, and
the lifestyle changes for autoimmune versus just hypothyroid.
Exactly. That being said, those are more in-depth testing that we do, and we really look into not just the TSH, the T3, the T4, but we look into the presence of R3. We look into the presence of other proteins that are in there. TG, which is a protein that is used with iodine production. So iodine is extremely important for the thyroid, and that's kind of something nutritionally we'll go down the road and we'll talk about once we get the blood work done.
And that's really the key too. So we get this blood work back, and we're not getting the blood work back just to write you a prescription. We're getting the blood work back to say, okay, we have this medical history, we have a little bit of a story about your lifestyle, we have this blood work, and let's look at those three components and see what can we do outside of just, now, and medication can be necessary, it really can be, but if you can go a different route and really work on lifestyle changes and nutrition changes and heal that thyroid before we run into this autoimmunity issue or before it gets really bad, then, I mean, that's just such a better way to go about it. And so then that's where we all sit down and we look at the results and we say, okay, we have these blood results. What can we change? Like, how can we make changes in your lifestyle, in your nutrition? How could we maybe go through a cycle of supplementation? We're not talking about something for your whole life, but a cycle that is going to bring those levels of nutrients up to where they belong so that this thyroid has all the constituents and vitamins and minerals and things that it needs right from your body to function at an optimal level. What's going on in there? How can we change that? And then
following up on that.
Yeah,
following up on that. So a lot of times, you know, you'll just get your blood work and
go on a medicine. You go on a medicine, and then next year maybe.
I think it's extremely important that, you know, if we figure there's something going on, and we are attempting to change that or modify that with, you know, supplementation perhaps, or just a dietary change, or, you know, an increase in exercise, you know, to reduce your stress level, or whatever it is that we need to do, 6 months down the road, we retest your thyroid and make sure that we're going in that right direction, because if not, then maybe there's another issue besides this that we need to address. Like perhaps it's just, you know, you've got some micronutrient deficiencies that we have to dive a little bit deeper into, you know, to start feeding. So there's a whole list of things that we can get into.
Well, and on the reverse side of that, if it is healing, then maybe you don't need to stay on that supplement. You know, you don't want to be on something forever.
No, they're not a dependent, and they're not there to use as a dependency. They're there to exactly what they say, supplement. And if you have the appropriate nutrition in your diet from food sources that we get each and every day, you shouldn't have to do that. So
right.
It's just kind of
and then lifestyle changes too. So we'll come in, we'll look at what's going on in your lifestyle, and we'll say, you know, if you're dealing, if this thyroid and adrenals are being challenged in a way, you know, are you training for marathon after marathon after marathon, which is really stressing this off. So how can we make those exercise and lifestyle changes? Maybe for a while, you know, yoga is a better option. Maybe just straight strength training is a better option. And we kind of cut back on that long endurance training. So there's tons of things that we can do to improve the health of this whole little HPA axis, basically. So yeah.
Yeah, absolutely. I'm so excited to...
You can come by Dr. Tiffany Love's office. They are out at
Highland City Publix.
Highland City Publix, their office is right out there. You can give them a call, 709-1600, right?
Wow, impressive.
Well, I come in a lot. Or you can come and see us at Haka Fitness. We can write you a script for their office. If you want to ask more questions about it, you know, whoever you want to call, either way, we can both answer more questions. We can just kind of send you in the right direction and get you started on the path to healing these issues and
better health.
Yeah, better health. Thanks, you guys. Thanks for tuning in, and I hope you got something out of it.